Hello everyone, my name is John. I'm a student physical therapist working under Dr. Pratt. Today I want to demonstrate how to use some electrical stimulation. I'm going to pick the biphasic way. It's a little more comfortable for the patient than Russian, but Russian is also a good option. So there are some good reasons or indications for why we would want to use biphasic treatment or electrical stimulation. One, for just electrical stimulation, is it's good for pain modulation. Our patient here today is 2 weeks post-op on an ACL reconstruction, and he's in the proliferative phase of healing. Thankfully, his pain has gone down quite a bit, so we're not going to really be using it for pain modulation since it's already well controlled. But other reasons you would use electrical stimulation is to reduce or prevent edema. And specifically what we're going to do with the biphasic current today is we're going to cause muscle contraction. This will help with his atrophy. It's pretty common after an ACL reconstruction to have some trouble firing the quads, and our patient is having that with his right quads today. So there are some contraindications as well why you wouldn't want to use this. If the patient has any active DVTs, deep vein thromboses, or active cancers, if they have impaired mentation, so they can't really understand what you're doing or communicate with you as to what they're feeling, you would want to avoid this. Also, if they have an implanted device like a pacemaker up here, again, just avoid that just to be safe and protect the patient. Another is if the patient is pregnant and has a history of miscarriages, you would want physician approval before you use this at all. And if the patient is pregnant but doesn't have a history of miscarriages, you would obviously not want to go around the abdomen or the pelvis. Another contraindication is if they have any type of seizure disorder like epilepsy. Again, avoid doing this on a patient. And finally, another one is you wouldn't want to do this over reproductive organs for obvious reasons. So, McLean, how are you feeling today?
Doing good.
Okay, are you comfortable how you're at?
Yes.
Okay. So my plan is to do some electrical stimulation to get your quads firing. Now I'm looking at your skin and I don't see any blisters or rashes or anything. So I think we're gonna do that, but I'm gonna ask you some questions first just so I know we're safe to do it. Have you ever been diagnosed with a deep vein thrombosis?
No.
Do you have any active cancers?
No.
Do you have any seizure disorders like epilepsy?
No.
Okay. Do you have an implanted device anywhere like a pacemaker?
No.
Okay. And you can see on the skin that he doesn't have any really superficial metal, so we should be okay to do this treatment. Is that okay with you?
Yes.
Okay, perfect. So I will now demonstrate how to set up the machine here. So I've already got it turned on in the back here, and as I stated before, we're going to do a biphasic current. So then this machine has some preset parameters. I'm just going to double check them before we start. So I'm going to come here. Okay, so I'm going to continue to demonstrate here. So I selected biphasic current here, and this machine has preset stuff, but I'm just going to double check and make sure that they're the parameters I want. So I'll come here and check the rate. Pulse rate of 50 is pretty much what you want across multiple different types of current. Pulse duration, we want 200 to 800, so 200 is going to be good. I'm going to come here and just check how often the machine will be going versus not. I'm going to do a 1-to-1 ratio, so it'll be on for 10 seconds and then off for 10 seconds. And then I'm going to increase the ramp time to a full 2 seconds. This is usually a lot more comfortable for the patient, and again, helps with the contraction. So then I will come here. And to do this, we want to turn up the intensity pretty quickly until they start feeling like the buzzing or the vibration, and then we'll back off a little bit, but we want it high enough to get a good muscle contraction. Okay. So I've already got the pads set up here. On a larger muscle like the quads, you want to use the bigger pads, otherwise it can be pretty uncomfortable for the patient. So again, I don't see any rashes or any blisters or anything like that, so we'll go ahead and get started. So typically you would want to do this for like 3 sets, about 10 reps, and give the patient a break in between. For the purposes of this video, we're just going to demonstrate a couple reps just to kind of show what we should be getting, okay? All right, so go ahead and communicate with me. Once you start feeling a buzzing, I'm going to slow down, but we want this to be a pretty good contraction. So I want you to bring this leg up, and I want you to just flex your quads as hard as you can on this leg, and this contraction should be about 50% of what you're getting on that leg, okay? All right, so I'm going to go ahead and start ramping up here. So tell me when you first start to feel the buzzing.
Feel buzzing?
Okay. Now I'm going to slow down, but again, we still want a pretty intense contraction there, okay?
Okay.
Okay, we'll go ahead and start. So as you watch, you'll see right there, his leg is contracting pretty hard. It can, again, feel a little uncomfortable, but using the big pads really helps as well. So again, we're going to go for about 2 contractions, so we already got 1. So then here in a second, we're going to get another. And after that, we'll go ahead and pause the treatment. And as you do this, I want you to be flexing your quad as hard as you can along with it. So that way we're kind of retraining that muscle and teaching it how to work again. Okay, perfect. So I'm going to go ahead and stop here. I'm going to turn off the machine just to make sure that we're not going to get any surprise zaps here. And I'm going to pull this off. This can be kind of painful if the patient has hairy legs. So you want to go from top to bottom as much as you can. And then after the treatment, you just want to check and make sure. Sometimes people can be a little sensitive to the adhesive. I don't see any red spots or blisters or anything, so I think we're all set to go. So I will go ahead and get this put away. And that is biphasic current.